this is Amanda with Jessica, Lindsay, and Lauren, and we're going to be talking about traumatic brain injury and orthopedic impairments. Orthopedic impairments means a severe orthopedic impairment that adversely affects a child's educational performance. The term includes impairments caused by congenital anomaly, impairments caused by disease, and impairments from other causes.
Orthopedic impairments are considered a low-incidence disability, so that means a less common disability by IDA standards. This means that students are eligible to receive IEP accommodations, and approximately 54,000 school-age students are receiving some type of special education services a year. Each child is unique and different. Even if two children have the same diagnosis, they still will not be the same in how they accomplish tasks. This is important for parents and teachers to know so that they can meet the individual needs of each child. Children with orthopedic impairments don't have cognitive, learning, perceptual, language, or sensory problems. They mostly just need assistance with physical tasks and activities.
As stated earlier, students with orthopedic impairments mostly just need help with physical activities. In the classroom, this means they will need special seating arrangements and help with gross and fine motor skills. Some students will need assistance communicating. There are, of course, other challenges in the classroom that may come about, such as struggles with peer relationships and tiring quickly. But despite the difficulties that can come with orthopedic impairments, these students can be successful in school as well as other activities they choose to participate in. Some of the possible causes: first, some students are born with or acquire bone, joint, or muscle problems. Examples of this are cerebral palsy, joint deformities, and muscular dystrophy. Other problems may result from injuries, surgeries, deformities, or diseases. Examples of this include loss of bone and or muscle tissue, sometimes resulting in amputation, as well as burns and broken bones that cause damage to both bones and muscles.
It is important for teachers, parents, and professionals to work together to help a child with an orthopedic impairment have success in school and in their lives. General education teachers, physical therapists, occupational therapists, speech and language pathologists, as well as adapted PE teachers might be needed to help plan the IEP. It is also important that accommodations are made, and some of these can include special seating arrangements, such as providing a special desk, instruction focused specifically on developing fine and gross motor skills, and other assistive devices.
Related services available for students with orthopedic impairments include assistive technology, special transportation, environmental adaptations, adaptive physical education, cognitive therapy, occupational therapy, physical therapy, and school health services.
Traumatic brain injury is sometimes called an acquired brain injury, and it is caused by an external force on the brain, and that can be caused by accidents such as motor accidents or falls, and it is the leading cause of disability and death among children. Students with TBI may have the same abilities that they had before their accident, but they might also experience a loss of capacity. Depending on the extent of the injury and recovery, students will be limited on what they can do, and those limitations may deal with their fine motor skills or stamina and maybe even cognitive problems. Families that have to deal with a child who suffers from a TBI may experience a range of emotions such as shock or denial, but eventually they do learn to adapt. Instructional supports for students with TBI include implementing daily routines for the students. This is important because students with TBI need structure and routine because most of them do have problems with memory. If a break in routine is necessary, the teacher needs to make the student aware of this break and possibly assign them a buddy to help them through this change. Patience is also key because their daily behavior and needs are difficult to predict. Flexibility and expectations is also needed since their skill level may vary day to day, as mentioned before, and students rely on teachers for emotional and social support during this time because they're facing new challenges, and so sometimes they need help managing their anger and frustrations. There's different types of areas of concern, and they include memory, attention, organization, and information processing. Some strategies with dealing with the different areas of concern are teach in small segments and give the student breaks, increase repetition during instruction, link new information to things the student already knows, create a visual schedule or checklist for the student, provide consistency, allow for extra time on assignments, and simplify oral and written instructions.